Well, hi, everybody. I'm Vicki Liviakis, and welcome to Body Beautiful. It's our brand new show where we talk to local doctors about the latest and greatest in cosmetic procedures, and we take your calls live on the air. Each week, we'll take a look at two different topics. In our first segment, we'll be discussing plastic surgery, and then later in our second segment, cosmetic dentistry. Now, first joining us this morning is Dr. Brett Stompro, plastic surgeon. We'll be taking your calls and emails with any questions you might have. Let's get a look at the phone number here. It is 800-440-4884. All right. Now, a little disclaimer here. Before we get started, any advice we give you today, obviously, we want you to consult your own physician. Let's just jump right into it. Good morning, Dr. Stompro.
Good morning, Vicki. It's a pleasure to be here. Thanks.
It's wonderful to have you here and our first guest for the brand new show here. You know, so many advances have taken place in the field of cosmetic surgery. It seems like everybody is getting in on the act, a little nip and a tuck here. You know, sometimes you can tell that it's done, sometimes you can't. We want to talk about some of the secrets of being able to not tell that you've had it done. What are some of the more popular procedures?
Well, the most popular procedure that we do in the United States is liposuction. Okay, and liposuction has advanced a tremendous amount over the last few years itself. It used to be like you see on some of the reality shows, but now what we do is we make a small incision and go in with a small wand that sends an ultrasonic wave down to the tip, and it actually melts the fat. And by doing that, we can go back and forth much more like a violin bow and do our three-dimensional sculpting.
So a little kinder to the body.
Much quicker recovery time, much less bruising, swelling, and much less discomfort.
Some of the other procedures?
Well, again, in terms of popularity, I would have to say that eye lifts and breast augmentations and facelifts and tummy tucks.
Okay. Well, you know, we actually have some footage of your office. Let's go to that right now. Tell us a little bit about what a patient can expect when they walk into your office.
Well, obviously, I mean, patients have a tremendous interest in plastic surgery. Plastic surgery itself has tripled in terms of popularity in the last 10 years. When people are interested in plastic surgery, what they're interested in is getting educated. So they come to the office for a private consultation and then they get educated.
Okay, now Botox. Yeah. That's what's being done here, evidently. It's something we hear a lot about. It's really popular. We talk about it in the media.
Right.
And we have the footage. Somebody's receiving it. Walk me through what that involves.
Bottom line is that the tremendous exponential growth in non-surgical procedures such as Botox, soft tissue fillers, as well as laser hair removal. But Botox is far and away the most popular. It reduces wrinkles. It's FDA approved. It's been tested for many, many, many years. And now what people do is they come in during their lunch hour and they have an injection, go back to work within about 15, 20 minutes.
Now, the woman that we saw, a patient that was having it done, she wasn't flinching, so this is not something that's painful?
Doesn't have to hurt. Does not have to hurt. I mean, if it's done in a gentle way, we use the smallest needle known to man and inject a small amount of that protein that relaxes the muscles and relaxes some of those wrinkles.
Okay, and now, of course, we've seen a lot of the Hollywood people, and they've had a little excess, you know, done. I guess one of the biggest complaints is that if it's done in areas of the face where you lose expression.
Exactly. And you know what? We do Botox in the upper segment of the face, mostly for those frown wrinkles between the eyes as well as for the crow's feet. But again, just a word, we'd never make it in Southern California because, again, in the Bay Area here, what people want is subtlety. They want to look natural. Okay, our biggest compliment is if no one knows we were ever there.
We can toot our horn a little bit. Actually, Botox was discovered by an ophthalmologist
right here in the Bay Area.
Exactly. So it was tested for many years for eyes, twitching of the eyes, cross eyes.
It was used for cross eyes, twitching of the eyes, and then they found out when they did it on certain adults that some of the wrinkles went away in the affected area. And they said, hey, we might be onto something here. Okay. And so we extended that application as FDA approved.
You know, you mentioned about liposuction, one of the most popular. Is it a replacement for weight loss?
Absolutely not. The ideal candidate is somebody who is fit, who's near their ideal body weight, but just has some stubborn areas of fat that are diet and exercise resistant. And then you can go in, again, with a new type of ultrasonic liposculpture and remove that fat, those fat cells permanently. And the nice thing about it is you don't grow fat cells back. Okay?
You know, I've met people who exercise and they can't get rid of just, you know, say after they've had a baby or something. There's just a little pooch left over. And is that what this is for primarily?
It
or
is.
Can you go for the bigger job?
As long as there's good elasticity, lipo is a great way to go. As long as it's, you know, again, the up-to-date way, as long as it's done in a safe environment, in a certified facility with a board-certified plastic surgeon or other very well-trained professionals. So, but if the elasticity is not great, then you have to go to other procedures that address the excess skin, such as a tummy tuck.
Okay. Now, your office is located in
It's in Danville, right there on Blackhawk Plaza Circle, and we have myself and my partner, Dr. Chang, who is also board certified. We have a staff of 14 that is there to basically educate the patient and to walk them through in a very seamless way from pre-op, operation, and then also.
And for folks who would like a complimentary consultation.
Yeah. They're able to call in and or to email us, and we're happy to provide that information.
Okay, and as you can see on the screen there, you can go to plasticsurgery.com or dial 925-736-0401 to reserve your complimentary consultation. We're going to take a quick break and then come back with your phone calls and continue our talk about plastic surgery.
Sounds like fun. Thank you.
Okay. And welcome back to Body Beautiful. We are talking with Dr. Brett Stompro. We'll be taking your calls with any questions you might have for him. Here's the phone number, 800-440-4884. And remember, any advice we give you today, obviously, you want to consult your own physician. Very important point during the break. You mentioned when you're looking around for a plastic surgeon, you want to be sure
that you get a board-certified plastic surgeon. You want to make sure that the person doing your case is somebody that's very well trained and has lots of experience in that area.
After all, it is your body.
It is your body.
Now, before we take any of your calls, let's get a look at some before and after pictures that you brought for us. This is one of your patients. And what were the procedures that this woman has had?
This lady underwent a gastric bypass procedure a couple years ago, lost over 140 pounds. And again, makes a very nice transition in her life, but is still left with some of the reminders that she was big at one point, with lots of extra skin.
Now, so gastric bypass, is that considered plastic surgery?
No, that's done by a general surgeon who basically is rerouting the intestines in such a way that it diminishes some of the absorption, and that leads to significant weight loss. And after that weight loss procedure, people end up...
And there's our after.
There's the after.
It's amazing.
It is remarkable, and I'll tell you, it's so rewarding to be involved in a complete transformation like this. So a lot of these procedures were directed at the excess skin. She had a breast lift with a breast augmentation, as well as arm tuck, tummy tuck, thigh tuck, some liposculpture, as well as a face and neck lift.
I was going to say, after that much weight loss, the skin would have a tough time springing back.
It's very difficult.
We've got an email, and let's just jump right into that. A question about what anesthesia is used during cosmetic surgery. This is Christina from Palo Alto.
Very good. Christina, very important question. Safety is the #1 priority in all of the procedures that plastic surgeons do, and we always do it with a board-certified anesthesiologist right there at the head of the table that's responsible for the safety and for the comfort of the patient. Typically, it's directed towards the patient and the procedure, so it can be anything from a little twilight anesthesia to a full general anesthetic.
Okay. You know what? Let's just jump right into these phone calls here, because the phone lines are lighting up. Joyce from San Francisco, you got a question for the doctor. Good morning.
Good morning. Hi. Yes, I'd like to ask about the lifestyle lift that I've seen advertised on TV a lot recently. I'm thinking about having it done for jowls and turkey neck.
You know, we have been seeing a lot of it, and they don't go into a lot of detail, so please spell it out for us, Doc.
The lifestyle lift has really attracted a lot of attention, and there's a very big marketing campaign behind it. The only thing that I'll recommend is that I think it's a very nice procedure. Smaller incisions, addresses some of the muscular droop that people get during the face. But the most important take-home point is make sure you get evaluated by a board-certified plastic surgeon to evaluate the total facial aging. So what I'm saying is that not every lift is going to apply to every patient. The lifestyle lift is very good for the jowls, but it actually doesn't address the neck as well. So some people need an isolated neck lift. Some people need a mid-face lift.
Hence the need for a consultation.
Exactly.
Okay, we've got another call. I guess we're going to go with Monique from San Francisco. Good morning, Monique.
Hi.
Hi, you have a question for a doctor.
Yes, I have a different question. Something came up to mind. What about people that have flat butts?
That's a good question, Monique. Body contouring is so important, and you have to put things in the best three-dimensional form. Some people want it off in certain areas, and they want it a little more enhanced in other areas.
Isn't that new, though? I mean, did we ever think about that before?
Well,
we
not
didn't
really.
Have the technology?
Not really. I think that there's always been a desire to have a shapely body, and if people want enhancement in that region, typically what they do is they do a fat transfer, where we'll harvest the fat from one area where they want to remove it, and then we'll re-inject reinject it or reimplant it in typically the buttock region as a fat transfer.
Okay, you know, we have some more calls, and I'm afraid we don't have time to get to those calls at this point, but we want to offer some information for folks to get a hold of you and possibly for a complimentary consultation. So for more information about Dr. Stompro, go to we know the WW is plasticsurgery1.com, or call 925-736-0401 to reserve your complimentary consultation, which is amazing, is it not? This is sort of like a virtual one at this point. And for more information about our doctors today, you can go to our website at cron4.com.